Thanks, everybody. Thanks, Kevin. Thanks very much for having me. I'm really excited to speak today. All right, I'm going to start by talking about Super Bowl 27, January 31st, 1993. The Rose Bowl in Pasadena. Dallas Cowboys versus the Buffalo Bills. The Bills were about to carry on the grand tradition of the AFC in the 1990s and lose ignominiously for their third straight Super Bowl in a row. Dallas, on the other hand, was about to win their first of 3 Super Bowls in 4 years. In the fourth quarter, with the game well in hand, Lett, a Dallas defensive end, picks up a fumble and starts scampering towards the end zone. He's a defensive end, maybe not so much scampering. I think Chris Berman used to call it rumbling, bumbling, and stumbling on his way. In any case, he's on his way to the end zone, and he looks up because he can see the Jumbotron up ahead and decides that now is the time for his SportsCenter moment. He's on the 10-yard line. He's 30 feet away from the end zone. This is his moment of football glory. Leon reaches out his hand, does the pose to get ready to win the game, or at least to win his touchdown, and get himself on the SportsCenter highlight reel. But little did he know that right behind him was Don Beebe, the Buffalo wide receiver who chased him down, took the ball out of his hands before Leon could cross the end zone. His little showboat act meant that Don Beebe could turn Leon Lett's moment of glory into the most infamous Super Bowl gaffe of all time. And really, this is where we are right now. We're 10 feet away, and what we don't want to do is end up like Leon Lett and fumble the ball at the last second. We can see the end of the pandemic in sight. We're so close. How do we make sure that we get this done and we don't make the mistake like that? Let's look at India. Even recently, as a month or two ago, India was being praised for its efforts against COVID-19. They were starting the vaccine rollout. Their health minister even said this is the end game of the pandemic. Well, we've unfortunately seen what's happened since then. This is the Kumbh Mela, which is a religious festival. 3.5 million people on the banks of the Ganges River, most of them without masks and none of them with any sort of social distancing. Of course, you can guess what happened next at the super spreader event to end all super spreader events. Combine that with political rallies and a general loosening of restrictions, and India is now the poster child for what not to do. They are now leading the world in COVID deaths and cases and misery. COVID's pretty wicked. If you lose your focus, if you don't keep your eye on the ball, it will take you out from behind and fumble. So how do we make sure we don't fumble the ball at the 5-yard line? So ultimately, the answer to COVID is vaccination. That's the key to ending this pandemic. And the problem is that we're not quite there yet. And misinformation, politicization of public health, and vaccine hesitancy is going to hamper what we've already done, the great job we've already done with this vaccine rollout. But in the meantime, we can't really wait for the entire world to be vaccinated before we get ourselves back to business. The effect of the COVID lockdowns and the restrictions have been devastating on our schools, our school children, our small businesses, our restaurants. And so the question is, how do we get back to reopening? What do we need to do to get back to normal until we get to full vaccination and herd immunity? Because really, until the entire world is vaccinated, we're all still a little vulnerable, or maybe a lot vulnerable. And the question is there some sort of a middle solution that bridges the gap between the the blunt axe of a lockdown and this laissez-faire attitude of, well, we'll just reopen the economy, everything will be fine, no problem, the virus will just disappear like a miracle? The answer is there is that solution, there is that middle ground, and the solution is something we've been doing for a while. It's called testing. So the problem with testing has been the original sin of this pandemic, at least how we've been managing it in America. From the CDC's bungled rollout of the initial tests to those long testing lines that we all saw on TV or had to sit through, the way that we've approached testing could be filed under a heading of how not to deal with the COVID-19 pandemic. It's been a problem from the beginning. The difference is now, all of a sudden, we now have something new on the horizon. Rapid antigen tests, which are easy, fast, cheap, and simple to do, that can actually give us actionable intelligence to make a real difference. These tests are so easy, even a school kid can do it. That's my son, who is my unwitting model. And these are easy to do, and the thing about these is that this lets us go on the offense. It lets us be proactive against COVID instead of reactive. And it lets us find those people who are sick and get them into isolation before they can infect others. Let's talk a few minutes about tests, because there's a lot of confusion between the two different types and what kind of test do you need. So the big ones that we talk about are PCR and antigen testing. And so the way I like to describe this is that if you're a detective and you're trying to find a bad guy out in the community, so you could take the fingerprint of the bad guy and you can go around and try and match it to every single person's fingerprint out there. It's doable, it works, but boy, it takes a lot of effort, takes a lot of machines, takes a lot of resources. It's not a very efficient way of trying to screen a large population to try and find your bad guy out there. But maybe there's another way. If you remember the old be on the lookout alerts, right? Wanted posters, descriptions. You say, okay, well, maybe we're not gonna look for somebody's fingerprint, but instead, we're gonna look for somebody wearing, I don't know, a red Hawaiian shirt and jeans. You know, maybe like this guy. So instead of that, you're saying, okay, we're gonna go out and try and find somebody wearing a red Hawaiian shirt and blue jeans. Now the problem is, of course, the virus is a little wily, and this bad guy that we're looking for, might change his image, might change his hair, might change his glasses. But for the most part, we can figure that out. The other problem, of course, is if some unwitting soul decides, today's a really good day to go out and wear my red Hawaiian shirt and blue jeans. And unfortunately, you end up picking up this guy instead of your target, and he gets picked up in the dragnet by accident. But for the most part, that kind of approach, this kind of more effective screening tool, is really useful and something that's much better at looking at and trying to find infected folks in the middle of a pandemic. And this is rapid antigen testing. This is an easy, simple way that we can use this to screen large populations of individuals. And the best part is that it's easy to do and it's low cost. So it gives us that whole thing that we talked about at the car shop, right? Good, fast, and cheap. Pick 2. You can get to 3 with this guy, which is kind of nice. So one of the things about rapid antigen testing is that it gives you the chance to identify people before they're sick because they don't have symptoms yet. There's a study right up the street at UCSF that said that these antigen tests were 98.5% sensitive at picking up contagious individuals and 99.9% at the specific at ruling out the ones that weren't actually sick. These tests can pick up folks who are contagious but yet asymptomatic. And that's really the key, because asymptomatic spread, the spread of the virus before you get symptoms, this is the hallmark of COVID-19. This is the absolute key as why this pandemic has been so bad. In previous viruses like SARS, people weren't contagious until they started having symptoms. It was relatively easy to sit here and say, oh, I've got symptoms, I need to go home and isolate, no problem. But with COVID, you get sick after you start spreading it to other people. So I'll give you an example. You could go and say, I'm gonna go see grandma this weekend. You go out and you get tested on Wednesday, your test results come back on Friday and they're negative. Great, I go see grandma on Saturday, all is well. Well, guess what? Now, on Monday, I start getting sick. I start getting symptoms. And the problem was, I started expressing viral load on Friday after I took my test, but I didn't have any symptoms. I exposed grandma on Saturday, and now I'm sick on Monday with the sniffle, grandma's in the ICU. This is what's happening with COVID, and this is why this virus is so hard to beat. And the problem is we've been using a lot of tools that really haven't worked very well. We've all seen this at the Apple store or anywhere else you go where somebody wants to take your temperature. Worthless. Most folks in COVID may develop a fever, but they're not going to do it until several days into the course of their illness. So checking somebody for asymptomatic spread of COVID with a fever scanner doesn't work. You can ask questions, maybe that might help a little bit, but for the most part, they're about as valuable as those TSA questions you have to use to answer. Remember, did you pack this bag, sir? Did anybody give you anything to put in this bag? And of course, no real terrorist is going to answer yes to those questions. It's not a very useful tool. Same kind of thing. What we really need is an actual tool with real results that actually can reliably let us find out people who are infected, who are contagious, and get them out of circulation before they can pass this virus on to other people. And what we're doing, again, really hasn't been working. We've been making people stand in these long lines. We've been telling them that you need to get the stick shoved all the way up your nose to the back of your throat and an inch away from your brain. And we're saying, and you're not going to get results for 2 or 3 days. Well, no wonder people aren't jumping through these hoops. Nobody's going to go and do this unless you have symptoms and you want to know if you have COVID. But the problem is that's not the folks we need to test. We need to test people before they have symptoms. This is where rapid antigen testing comes in. What we should be doing is we should be getting these tests out all over the place. Everybody should have them in their home. People should take them every day. And they're actually starting to do this in places like Colorado and North Carolina, where they're sending tests to people at home, or you can pick up the request tests from Colorado. They're starting to get to the point where they're cheaper, but they're still a little on the expensive side. Hopefully we'll get to that point soon. But the other thing that we can do is we can start having verified screening programs at important places where people could transmit the virus, places like your workplace, or sporting events, or youth sports, or or youth sports or sporting events, or just events in general. These are all places that we can put together screening programs and say, let's screen people before they have the chance to infect other people. So the interesting thing about kids is that we used to think that schools are going to be these super spreading hotspots and that we were going to have to close schools and do all this stuff with schools. What we're finding is that schools themselves may not really be the hotspots we were worried about. But youth sports, on the other hand, may very well be, and a lot of it is that these kids may not actually be getting the virus at school, but they're getting them in the after-school sports when they're out playing baseball or football or what have you. It might be that they're doing this unmasked, they're doing it in close proximity, but instead of just hoping that kids don't get sick or testing them once a week and then having them play a game 6 days later when in the interim they might get infected, what if we did a rapid antigen test for every athlete right before they play their games? We can screen them immediately and we know if they're shedding virus and say, hey, you know what, you tested positive, you can't play, and save all those other kids out there from getting infected. Workplaces are starting to become an area of tension as well. We're seeing folks who are vaccinated and folks who are unvaccinated pretty nervous about mingling with each other and going back to the workplace. What if we said we're going to set up screening programs where employees can get tested before they go to work? And that way we know for a fact whether you're sick or not, whether you're contagious or not, and we can get people back into the workplace safely. And in Monterey County, and all the other counties as well, but especially ours, and especially here on the peninsula, events are the lifeblood of our economy. Whether it's conferences or conventions, parties, or car week, events are what drive our community and what keep us going. And so what if we said we're going to screen every attendee to any one of these events? We're going to say you got to get tested before you come in. What if we screened everybody at the airport when they arrived? Alaska's doing this, and it's working really well for them. And say everybody gets, before you come into Monterey, you got to get screened at the airport, and then you're not bringing this virus into our community. This can let us reopen our events safely. So the other thing people talk about is vaccinations and using that, but how do we know that somebody's really vaccinated? Vaccine passports have already become this huge hot button issue, and we've seen a relentless politicization over that and over testing and positivity rates. How can we be sure that somebody's vaccine card that they're showing us really proves that they're vaccinated when they can buy this stuff on eBay? But what if we said we're going to combine vaccination with a quick antigen test? So that you're going to an event and you say, okay, great, you need to be vaccinated and we're going to do a quick antigen test. That way, just in case somebody slipped through the cracks on vaccination, you've got a verified antigen test that they've done before they walk in, and you know for a fact that everybody coming into that event is clear. And then you could have things like COVID-free zones. You could have a COVID-free event. And maybe we might be able to loosen up on some of the masking and social distancing restrictions and, I don't know, be able to go to a bar? It'd be kind of nice. So these are a lot of different things we can think about doing. I fully believe that using rapid antigen testing in conjunction with other things is the way out of this pandemic. This is an adjunct to what we're already doing, but it really gives us the chance to be proactive, to go on offense against this virus and say, we are going to find people who are infected before they have symptoms. We're going to find them, we're going to isolate them, we're going to get them out of circulation, we're going to stop the spread of this disease. So in order to bring this to Monterey County, a colleague and I created a startup that we're calling Lightspeed Testing. And the goal of Lightspeed Testing is to bring rapid antigen testing at high volume, at high scale, anywhere it's needed on the peninsula or in the county at large. Whether it's events or sporting events or sports or youth sports or workplaces, anywhere that needs this, we can bring this to them. We're using things like the Toyota production model and lean production techniques to try and minimize the amount of resources that we're using, and so we can get people screened relatively quickly with a minimum amount of footprint and a minimum amount of resources. And the best part is that because of new federal regulations, this testing has to be covered by insurance. So it means that we can do these tests at no cost to individuals and no cost to businesses because the insurance carriers have to carry it and the government will pick up the tab even if you're uninsured. So this is really exciting and we're really hoping to roll this out at large. The other thing that's really helpful about what we're doing is that because we're a local business and we have local ties to our local community and our local medical community, it means that we can bring people in to get the extra resources and the extra therapies that they need if they do come up positive. One of the things that I've been doing as an emergency physician is we've been giving antibody therapy, monoclonal antibodies. The problem is that they need to be given within the first few days of infection. Usually by the time we see somebody, they've had symptoms, they've thought about it, then they've gone to get tested, and then 3 days later they get the result that they're positive. And finally, by the time they come to see me for their antibody infusion, they're already 10 days in, it's too late. If we can get people tested early, we have the connections to be able to get people into those therapies right away, even the next day. This is the advantage of being a local business with local ties to our community. So rapid antigen testing isn't always it's not the be all and end all, it's not perfect, but it's pretty darn good. And it gives us the ability to get our economy back going. It lets us reopen our economy, it lets us reboot our businesses, and to let us restart our events safely. I fully believe this is one of the ways that we can get out of this. And to quote another traveler through strange and difficult times, this is the way. Thank you.